Good afternoon. My name is Gretchen Kanan. I'm the Public Relations Specialist for the Topeka Police Department. First, I want to thank all of our viewers on Facebook for continuing to join us every day at these press conferences. I also want to thank our local media partners, KSNT, WIBW, and the Topeka Capital Journal for their commitment to keeping all of the citizens informed. With that, I will introduce today's speakers. First, Director Linda Oakes for the Shawnee County Health Department. Second, Topeka Mayor Michelle De La Isa. And third, Director Dusty Nichols. With that, I will bring up Director Oakes. Thank you.
Thank you. Good afternoon. So today we have 11 pending tests. We have 109 negative tests, and we are still monitoring 147 people who have traveled. And I just want to reiterate that phone number to call us if you have traveled. If you're coming in today or tomorrow from travel to the affected areas, you need to stay home. The nurse will call you as soon as she can. It will try to be Monday. 5-806-6297. Again, that's 785-806-6297. Leave a message and we'll call you back. And just to remind you, the travel is from California, Washington State, Florida, and any of these counties in Colorado, Eagle, Summit, Pitkin, and Gunnison counties, any cruise ships, including river cruises. Thank you.
The mayor's one.
Good afternoon, all of you. Here we are again. We really don't have a lot of new things to share with you. I can tell you that our team has been working really hard, making sure that we continue communicating. Just a quick update with regards to the legislative package that I announced yesterday that the U.S. Conference of Mayors is supporting. Around 1:30, I think we received an email from the U.S. Conference letting us know that the Senate was at that point in time meeting. That conference, the package again is for $250 billion to go straight to cities and municipalities. Please make sure that you reach out to both Senator Roberts and Senator Moran if you're in favor of communities receiving direct funds from the federal government so that we continue supporting our businesses and our continuity with government services. I will now go into Spanish really quick. Para todos los que están viendo, Linda Oakes, el Departamento de Salud, indicó que habían 11 casos pendientes, habían 109 casos que son negativos y tenemos 117 personas que están ahora mismo siendo observadas porque hayan viajado a algún lugar. Así que esos son los números que tenemos ahora, no hay nada nuevo que reportar hoy, solamente estamos dejándoles saber a todos ustedes que es muy importante que se comuniquen con el senador Jerry Moran y con el senador Pat Roberts para que le dejen saber que ahora mismo hoy estaban como a la 1:40 deliberando en el Senado sobre el estímulo que estábamos pidiendo del gobierno federal para que dólares vengan directamente a ciudades para que podamos ayudar a nuestra economía. Muchísimas gracias y seguiremos en contacto.
Good afternoon. I just wanted a couple things that have come up today. We had a statewide emergency management conference or a phone conference, and a couple things that popped up that were kind of interesting to us. So I want to clarify a few things. First and foremost, there is no travel ban. People can move it in and out of the city, move it out of the county. The intention of these orders that Dr. Brazino has put out is to reduce the crowd size for an extended period of time. People can go to grocery stores, they can go to a quick shop, they can go to wherever they need to go. Just don't congregate. Get your business done and get back out. We've got reports that AMR and some other people in uniform are getting approached and asking where their papers are to travel. I don't understand where this is coming from, but if you're approached by that, it's not real. There's not any order to enforce that. We do have our law enforcement partners here to expand on that afterwards. One of the things I want to really talk about too is the National Guard. That rumor just does not seem to go away. As the emergency manager, I would have to request them to come in. I'm not doing that. We have no reason for them to come here. That said, There are certain missions that they're prepped for, they're ready to do, deliveries, there's all kinds of missions those guys and women can do. So they may be spent up for missions and waiting for us to request that. We have not requested the National Guard to come into our county or city or anything else. Please quit spreading that rumor. Please, it's not helpful. And lastly, we want to talk again about business continuity. If you are a business and we know you've been impacted majorly and you're trying to figure out how to keep drive-thrus open and try to keep deliveries open and those kinds of things, those are the things that we want you to really think about. That's continuity, obviously. How to keep your business going. What we're really looking at, as we look across the nation, I think Dr. Bazzino will kind of touch on this as well, is are you critical to the how the city works or how the county works? If you are, really consider business continuity. How are we going to keep that going? Do you have the workers if somebody were to get sick or family members get sick? Do you have that coverage? Please start making those plans. We don't need our critical services dropping off for any reason. If somebody gets sick or a family member gets sick or has to step out, or just fearful to come to work. If you're following the guidelines and you don't have the symptoms, and you're keeping your places clean and all those kinds of things we've already asked you to do, those things should not be an issue. So if you don't fit that criteria, there's no reason to self-isolate and so forth. So really consider business continuity right now as we start shrinking down workforces and working from home. How do we keep businesses going? From what I've seen, I'm just going to talk straight. Y'all are doing great. Y'all are doing really good social distancing. You're working from home. You're putting all those IT things in place. You're keeping the businesses going. You all are doing really, really good. Keep that up. Please don't cause us any more problems. And I say us, not me necessarily, but our entire community. You're doing great. Do it with us. Thanks.
I'm going to say that in Spanish.
I'm going to repeat what he just said in Spanish for our viewers. Para todos los que son dueños de compañía, ya sea las tiendas en la calle 6 o cualquier negocio que haya aquí en la comunidad, es importante que empiece a hablar sobre su plan de continuidad de su negocio. Necesitamos que piense si necesita tener más empleados, qué hacer si enferman ciertas personas, especialmente si su negocio es crítico para la salud de la ciudad. Por ejemplo, alguien que trabaje en donde usted hace compra, es importante. Así que piense, por favor, en sentarse con sus empleados para que haga un plan de continuidad. Segunda cosa que le queremos decir es que hemos encontrado que no importa cuánto hemos dicho que el gobierno federal no va a mandar a los militares a caminar aquí en la ciudad y a cerrar la ciudad, no es cierto. Lo repito nuevamente. El ejército no está viniendo a la ciudad de Topeka o a Shawnee County a hacer nada. No es cierto. Así que por favor, si ve ese rumor, diga no, para el rumor. Ya lo hemos dicho 3 veces. Así que por favor, manténganse al día con la información a través de nuestros amigos de CJ Online, el periódico Capital Journal, KSMP, o WIBW, que son las personas que le están transmitiendo información correcta. Otra vez, no hay. Otra cosa que es extremadamente importante, recibimos información hoy de que 2 personas fueron paradas en un lugar a preguntarles, ¿qué hacen ustedes afuera? Denme sus papeles. Nadie está diciendo que usted tiene que estar dentro de su casa ahora mismo. Esa no es la orden. Si alguien lo para y le dice, deme sus papeles, porque usted no puede estar en la calle, no le haga caso. Simplemente le dice, caballero o dama, muchas gracias, lo siento, y se mueve en su carro y se va. No interactúe con esa persona y repórtelo, por favor, porque eso no es cierto. No hay un toque de queda. No estamos en toque de queda. Usted puede comprar sus cosas, hacer lo que tiene que hacer, solamente mantenga distanciamiento social y no estén en grupos. Recojan sus cosas y regresen a su casa. Recuerden, están más protegidos en su casa. Así que no se preocupen, si alguien le pide papeles, no se apuren. Ahora les vamos a introducir al doctor Gianfranco Pezzino, que es el director de la salud aquí para el condado de Shawnee. And now we're going to introduce you to Dr. Gianfranco Pezzino, who is the director of the health person for Shawnee County Health.
Good afternoon, everyone. I really don't have much to say, so I'm not here to give you big news or to tell you that I'm going to shut down something else, as I did the last couple of times I was here. But when I was talking to Dusty and Linda, I thought that maybe we could take advantage of having a little bit of time where we can, instead of just going over the crisis of the day, just talk a little bit more in depth about what this all means for everybody, and kind of any questions that you may have for your health officer, and what's ahead, and how we feel about that, and this kind of thing. So this is really, it's going to be mostly you asking me questions. But before I do that, I thought that I would do something that I don't think I've done with this crowd before, which is telling you who I am. Because all you know is that I'm Gianfranco Bezzini, County Health Officer. You know nothing else about me, most of you actually. So let me tell you a little bit about my story. I wasn't born and raised in Kansas. I know it will come as a shock to you. I was born and raised in Italy, in a town called Lucca, which is about, it's a beautiful old town, about the same size as Topeka, roughly 50 miles west of Tuscany, west of Florence, in Tuscany. I went to medical school in University of Bologna, northern Italy, the oldest medical school in the entire world, 540 years, I think, and counting. And then I went to work overseas after I graduated from medical school. I thought that would be my career for the rest of my life. I loved working in Africa in public health roles, and that was actually my first encounter with public health was in Africa. Until I met the Kansas girl. And that kind of changed the plans. I met my wife, who was from Newton, and to make a long story short, because otherwise we'll be here all night talking about myself, we ended up being married and then relocating to Kansas, which is where she's from. My passion has always been in public health. So once I came to the United States and we decided this would be our new home, after spending a year in graduate school, I went into a residency program in the Centers for Disease Control, the CDC, and I was, my title was Epidemic Intelligence Service Officer. So I was an epidemiologist in training. That's where I learned a lot of my epidemiology at the CDC. After spending a couple of years with them, I came to Kansas to become the first ever state epidemiologist in Kansas, and spent 10 years in that position. From 1994 until about 2004, and if I were still in that position, I would be pretty much in charge of the response to this outbreak at the state level. I'm very happy to be where I am, because I think I don't envy my colleagues at KBG right now. After that, I went to the Kansas Health Institute. That was my main job. It's a non-profit private organization that does health policy research and policy analysis on health and public health issues. And I've been there for 15 years, 16 actually. During that period, about 3 years into that tenure, I was approached by the county health department. The local health officer at the time, Dr. Romans, decided to retire. And of course, I knew the people at the health department from my previous position in the state. And the law says that the health department must have, the health department of any jurisdiction with greater than 100,000 people must have a medical doctor as a health officer with experience and training in public health. And so they came to me and they said, "Do you want to be our health officer?" And I said, "Sure." So I took also that second hat for me, and being the health officer for this county, I believe it's probably 12 years now, at least, maybe more. It's been a long time. I'm still married with the girl from Newton, and she's a physician here in town. I have 3 grown children, all living in the area, and I'm expecting my first grandbaby, and I am totally freaked out with the idea of not being able to hold the baby when it's born, because my daughter is due in June. That's all I have for you. Now, I also have some questions in my mind. In case you run out of questions, I'm going to tell you what questions I want you to ask me. But I suspect that some of you may already have your own questions, so I'm going to keep mine on hold and shoot.
You served on the Board of Education of 501. Could you tell us about that?
Sure. That was a very brief stint in the board. I replaced Judge Mark Brown, who was on the board, and then the time he was appointed as judge, he had to retire from the board. I think I was on that board for about 8 months, after which time, based on the time, I had to run for office. I ran and I lost. I don't regret that I did that. I am not very sorry that I lost, because one thing I learned during that time is it's a lot of work. It is an incredible amount of work. Just to give you a sense, the moment you become a board of education member, they come and put outside of your door a box about this size. That's just reserved to the mail that they will distribute to all board members before a meeting. And that box is usually full before each meeting. So it taught me even more respect for our educators. My mother was an educator, so of course I already had respect for education, but that experience was a really formative experience for me, that I was pretty sure.
You were talking at the press conference yesterday about what's happened in Italy, about how they didn't take enough action early on, and they have suffered a certain amount of trauma. Have you actually personally talked with people there who have dealt with that?
Oh, I've talked to my brother who's still there yesterday, I believe it was, yes. It's heartbreaking, that's all I can tell you. They have been in a lockdown for about 2 weeks now, and the lockdown was only the last step after a series of increasingly restrictive measures, because of the schools, and then putting just a few towns in lockdown. Finally we put the entire country in lockdown, which means essentially nobody's supposed to leave their homes unless they have a need to go to a doctor, or they're part of essential infrastructure, or to buy groceries. Despite that, their death rate continues to climb. So every day they are having more deaths than the day before. Yesterday they hit 600 deaths in one day. Actually, 2 days ago, I talked to my brother yesterday. Was is considering a stricter rules, like shutting down all the factories, for example, all production and manufacturing. The outbreak right now is central primarily in northern Italy, which is really the economic engine of Italy, where a lot of the big factories and small factories are located. And Italy is already collapsing. And they have to take the measure with the even worse. The healthcare system is absolutely on its knees. The main region affected is called Lombardia, which is the region around Milan in the north. It's considered one of the best healthcare systems in entire Europe. They are so overwhelmed that they are appealing to doctors from other parts of Europe to come and help them. They're going to feed them and lodge them and give them a tortilla. They put out those notices in English because they hope that somebody will come and help them. I'm not holding my breath. Unfortunately, he's not alone now in the fight against the virus in Europe. They're using army trucks to take caskets with people away from certain areas because they do not have cremation facilities sufficient to take care of all those people. Some nursing homes have had an attack rate of 100%. 100% of the rest. That will guide then our decisions about what is the next step. If I knew how this infection and this disease is spreading in our community, it would be so much easier for me to decide when is the right time to close the schools, when is the right time to close the restaurants, when is the right time to shut down our businesses in town. Right now we don't. I already gave it an analogy last time I was here. We just try to navigate a dark room with a little flashlight on your phone. And you only see a little thing at a time and you can't get the full picture. I wish I had better news, but unfortunately I don't. testing is lacking. The capacity is very low. It is not getting any better. If anything, there are concerns it may be getting worse. At the beginning, we didn't have test kits, so those are the kits that you actually use in the lab to do the test. Finally got the kits. The lab at the State Department of Health and Environment is running 24/7. Now they're running out of swabs, which are the kits to collect the specimen. They're running out of some preliminary reagents that they need to then, in the lab, to then be able to do the test. It's just one day after another, it's a disaster. I do not anticipate that this will go much better. The only hope here is that there are more private labs now that have announced that they can do their tests. Because so far, it's only the State Department of Health and Environment lab here in Kansas. And we are starting to see here in Shawnee County a few lab results trickling in that are coming from private labs. So hopefully, it will be a little bit easier access. But we should be testing so many more people. We should be testing anyone with symptoms that could be consistent with coronavirus, and we are not. We should be testing our healthcare workers once a week, and we're not. We should not be testing asymptomatic people, perhaps with the exception of healthcare workers, because if you don't have symptoms, then you don't get the virus. Or you still have the virus, but it's a very low level. So doing that at the mass screening for everyone wouldn't be productive. So I'm not in favor of the ideas of, drive-in type of thing where anyone can pull in, I just feel like having a test today, let's get the test. That's not a good use of resources. Even assuming that we had all the test kits, which we don't, it wouldn't be a good use of resources. But anyone with cough and fever, I think we should be testing them. We don't know what we don't know. We don't know how much of the disease we have in our community. I suspect we already have it, even though we have not a single case reported. So I'm glad you asked. I wish I had better news for you. Testing is still a big problem. The only good news is that hopefully through private labs, there will be more availability. And please don't get me wrong, this is not a criticism to my colleagues at KDHE. I have a lot of admiration and respect for them. They're really working very difficult situations. That's the cards that they've been dealt, and that's what they can play with.
Dr. Pizzino, it sounds like the FDA has approved a new rapid test today. Do you see that as being hopeful for us?
If it's true, yeah. I believe when I see it. Let me just say that. We have heard so many, it's been 2 weeks since we heard that there was 1 million tests coming to us, not necessarily just to Kansas. We haven't seen it yet. So, yeah, that's going to be great. Anything that can improve the availability of testing to people who need it, that would be great.
So we understand more people have tested positive since KDHE put out their daily numbers this morning. Are you able to provide an updated amount
For KDHE or
for KDHE?
No. All I know is what you told me from media, which is there are 2 more cases in Douglas County, and those are working travelers. So that makes already 3 travelers in Douglas County, counting next door to ours. That's why I found it so hard to believe that we do not have a case here. And that's why we closed our schools a few days before the state did. Because we have 30,000 students coming back from spring break into the county all at once. And many of them have traveled to states that are already hot spots. So we know that traveling is a risk factor. But that's all I know. I will not get any more updates.
We heard from some people that before getting actually tested for the virus itself, their physicians have tested them for strep and the flu. Can you explain maybe why they're going that route? Is that just to kind of rule those things out, and probably because those tests are a little bit more accessible than the COVID test?
The reason is that, at least at that time, and I think it still applies today actually, it makes sense to first rule out more common causes of disease. So this coronavirus is going to look just like the flu, like a bad case of flu in most cases, and sometimes maybe a mild case of flu, because we know that most people actually don't come down with severe symptoms. And so it makes more sense to say, well, let's rule out other things that we know are more common before we test for coronavirus. So strep, There is something called respiratory viral panel, which is something else that people do. It's a battery of viruses that can cause respiratory disease from common cold to other things. And then there is the influenza test. So those are usually the three most common tests that are run. And then if they're all negative, people say, okay, let's think coronavirus. We are at the point now where I don't think that that's really necessarily best practice. Some people still do, other people will just, especially if there is a high level of suspicion, will just go straight for the corona test. But if they do that, the other test, there is a good reason for that, yeah. We still have the flu in our community, we know that.
I got a question here from our Facebook. Is the test ran with a respiratory panel swab?
The coronavirus test? It is the same kind of, I think it can be the same swab to run all the tests, but the state lab will not run the coronavirus or the influenza test. The state lab will only run, I'm sorry, the state lab will not run the respiratory viral panel or the influenza. It will only run the coronavirus. So, for practical purposes, if a provider wants all those tests to be run, they need to have two samples. One to send to the state lab for coronavirus, the other to send to a private lab for everything else. If they are sending the same swab to a private lab, then we have to follow the direction of the lab, but it's possible the lab will accept just one specimen.
I got one more here. When will we know if the preventive measures, school closings, business closings, all these, will have flattened the curve?
Some of you may have heard the expression, we are always playing chase game with the virus, or we are always 14 days behind. The reason is because of the incubation period, right, which is up to 2 weeks. Actually, it turns out it's short, most of the time it's shorter than that. It's more like 5 to 7 days. It can be up to 14 weeks. So if I receive a positive report today, hey, we have our first case, where in reality our first infection happened maybe as far back as 14 days. That's an important consideration to keep in mind, because any measure that we put in place today will not affect the number of cases reported for up to 14 days. The other thing to keep in mind is that we know from other countries that, and from the United States, other parts in our country also, there is something called exponential growth of the virus, which means it's exponential, it's not plus something every day, it's a multiplier, okay? So if you look at those curves, they start flat, then the virus appears, it goes up a little bit, the virus becomes closer, it goes up, and then it goes, woo, almost vertical, right? Depending on when we institute those measures, it's going to be more or less easy to flatten the curve. The experience from China shows that the outbreak there peaked at about 8 to 10 weeks. You all know what kind of measures China put in place in terms of social distancing and locking down the entire large cities and so on. Italy is not even at 2 months yet, so obviously we don't expect them to peak or to have peaked already, meaning that the curve has reached the top and then starts coming down. But they're also not seeing any sign of slowing down, and that's slow. So it's hard to tell. I know it's a long answer. It's hard to tell. It's going to be several weeks, certainly, possibly months, before we can say we are out of danger. I would certainly say months, more than weeks. What I can tell you is that all the measures we put in place so far, they are based on the best available evidence that we have, things that can help. And everybody we talk to in Kansas, outside of Kansas, the mayor is in constant contact with other mayors and cities that are heavily affected. They all say, you're doing the right thing, I wish we had done it earlier. We have the luxury here that we are lagging behind the rest of the country, right? That's one of the advantages sometimes of being in the Midwest. things started, as they often do, on the east and west coast. Then eventually they will come here. When, I don't know. But this is precious time that we have now, because that's time to get prepared. Our friends and colleagues and families in the cities and in California, in Seattle, they had no time to prepare. It hit them like big brick in their head, and wow, what's happening here? What just happened? We have had several weeks to prepare. The level of preparedness we have is improving every day. The more time we can buy right now, the easier it's going to be for us to respond when the virus is detected in our community. You want my questions then? So you can ask my question? Well, one question you can ask me is, what keeps you awake at night? And what makes me sleep at night? What allows me to sleep at night? You want to know? I tell you what keeps me awake at night. It's a couple of things. First of all, it's our nursing homes. I can't imagine of a more vulnerable population and a better incubator for the coronavirus than a nursing home. Remember what happened in Crooked? That's where it all started, right? They had a fatality rate, I believe, of over 25%. I think about 25% residents died. Maybe you should report me that, because I'm not 100% sure. It's high. It's very high. Already told you some nursing homes in Italy with an attack rate of 100%. That keeps me awake at night. The other thing that keeps me awake at night is our childcare situation. If we get to the point of doing things like other cities are doing now, shutting down their businesses, what are we going to do with our childcare? There is a public health aspect of me that says, sorry, as hard as it is, we need to shut them down. And then there is the other part, also public health, but also as a more pragmatic member of the community. Can't be, people can't go to work. There is a large amount of healthcare providers, especially nurses, who are willing caring for preschoolers, and those need to be in child care. The last thing we want to have is losing healthcare providers because they have to stay home because they can't place their children in child care. I don't have an answer for that yet. Charlie thinks if we can buy a few more days to prepare some contingency plans to assist these people, that would be great. Then there is something else that keeps you awake. That's a little bit more global. I don't know if any of you in the media have, or maybe people are watching us, have heard of a report that came out, didn't get a lot of coverage, I don't think. It was released by the Imperial College of the United Kingdom. I had to look it up, I'll be honest. But it's legit. That's one of the oldest colleges in London, very prestigious. They did a simulation. So what a simulation is, they input some assumptions based on what we know about the virus now. And we're starting to learn more and more, everything in China, in Europe, etc. And then they simulated, using powerful computer models, they simulated what's going to happen if we do nothing, if we do this, if we do this plus that, and so on and so forth. I'm going to tell you what their conclusions are, especially if we do nothing. If we do nothing, about 80% of Americans will be sick. About 0.9% will die. So people say, it's not a very big number, 0.9%, that's, well, first of all, it's almost 10 times as many people die who acquire influenza. Second, the age distribution is not equally distributed. So what that means is it would be 2.2 Americans that would die even if they get treatment. But the problem is, this is a virus that is so contagious. There will be so many people, think about it, 80% of Americans will be sick. Our healthcare system will be overwhelmed so quickly that in reality, the number of people who die will just about double. So their projection is for about 4 million people to die in this country. If we do nothing, it's a projection based on computer models. There may be, there is a certainly marginal error. If we do nothing, that's what they're looking at. I don't know about you, 4 million people is a lot of people. It's a population of Los Angeles. It's how many people died in the Civil War on both sides. And it can go on and on and on. Now, what happens if we do something? If we do some mitigation strategies like isolation and quarantine, the death rate will be cut into half. So we have about 1.1 million people instead of the 2.2. And most of them will be able to access ventilators and healthcare. So the number probably wouldn't go up by much, just because we wouldn't have enough ventilators. If we do those relatively simple mitigation strategies like isolation quarantine, plus more social distancing, like some of the things we have done in this community, shutting down schools, banning gatherings, and so on. That would work, and that would bring down the number even more. However, here is the catch. We need to build immunity in the community, because we can't eradicate this virus. We need to build immunity. So one way to build immunity is to just let the infection go through our communities and have 4.4 million people die. Probably not ideal. There are ways to vaccines. We are all very hopeful for vaccine ready, but it will be about 18 months before the vaccine is ready. So the caveat on those numbers is that the isolation, quarantine, and social distancing will work for as long as they are in place. The moment we lift them, and the virus starts spreading again, because we have no immunity, then we have to reimburse them again. So they actually did some modeling, and they said that probably we could get by in many communities by lifting those measures for, say, 1 month, and then reimposing them immediately if there is evidence that the virus is coming back. I invite those of you who are interested in this, just check it out. Just Google Imperial College of the United Kingdom and you'll find the report. It's very well done, and as you can imagine, I found it very easy. But here is what allows me to see a little bit better. It's the level of support that we are receiving from this community. Like many of you probably, I'm on Facebook, my wife is on Facebook, I've been into Peak now for 25 plus years. I know people, I'm receiving so many expressions of support, encouragement, solidarity, telling me, my reply is, I'm not a hero, I'm just doing my job here. I'm not risking my life, I'm doing my job. The heroes are those healthcare workers, especially those who are in contact now with acute sick patients. All of them actually, but especially those who are actually screening these people and deciding whether they're at risk for coronavirus or not. Be careful. Take care of yourself. You are a hero, but don't be a hero. Use all the protection. Just give the executive summary, and then continue to open up the speakers.
Doctor, what's your wife's first name?
She will give an out here. I don't know if she would, she doesn't have my last name, so you wouldn't recognize. But she's working here in County, Virginia. Any other questions? Okay, I'll give you my last question, then I will stop, because it's way longer than I should have. What's down the road? What's gonna happen? So I pulled out my crystal ball today, and what is if we want to have a glimpse of what could happen, I'm not gonna say what will happen, what could happen, all we have to do is just look around the country. Again, Kansas in general has been hit less than other states, and our community within Kansas perhaps less than other communities. But if you look around, also in some other rural states, or some large rural areas like Illinois and others, way, both individual respect, and respect for people's human rights, and respect for people's rights to move around, but with the most paramount attention to protecting the health of the community as a whole. That's what we support, or essentially we don't know. Anything else? Okay, who's next?
Thank you, Dr. Pizzino, and all of our other speakers for being here today. I want to let our media partners who are here know that Chief Cochran and Sheriff Hill are available to answer any of your questions after this press conference. And before we close, I want to remind all of our viewers about the Shawnee County COVID-19 Updates Facebook page and Twitter account. That can be found at the handle, if you just do the @ SNCO COVID Update. Again, that's the @ SNCO COVID Update. Thank you, and we'll see you tomorrow at 3:30.